Speak to any other organizers or panelists on the line. When you are ready to begin the presentation, press the Start Broadcast button on the GoToWebinar control panel to allow all attendees to hear you. This system will notify you once you begin your broadcast. The broadcast is now starting. All attendees are in listen-only mode.
Taking a breath and gearing up for 2020. This is our first broadcast for 2020. And the goal today is pretty simple. We just want to do three things. So number one, we're going to save you a lot of time this year. There's a lot of things to remember. We have a lot of tools in place. We're going to go through a lot of these resources, which are going to do number two, which is increase your efficiency. So that way, you know exactly how to find an answer to the number of questions you're going to be getting on a daily basis. And number three is increasing profitability for your agency. Once you have the knowledge, which we're going to go through today, this is going to make the account management and the production much easier going forward in 2020, because we're going to outline where the advantages are and where you can really go after it in a very efficient way. So let's go ahead and get started. What I wanted to do is, as we're going through this today, you're going to actually get a copy of this presentation in its entirety. So don't feel like you have to scramble to write notes down. You're going to get it, the entire presentation. If you do have questions along the way, there is a question box. Please feel free to insert questions in there. We have a lot of material to cover today. If we do not get to the questions, please don't worry. We'll have all of those answered when you get a copy of the presentation. So with that, let's go ahead and begin. The agenda for today is very simple. We're just going to go through the carrier highlights, and that's going to be the underwriting changes, the rate changes, and the product changes. We're going to go through Anthem Large Group. We're very excited to have a new partnership with Anthem Large Group, 100 to 300. For those of you that are in that space, we've got a lot of competitive advantages we want to share with you today, why it makes sense to put the RFP through Beere&Purves if you have opportunities in that space. Number three is legislative updates. And when you're meeting with groups, oftentimes groups are not aware of the legislative changes and the mandates that they have to comply with. And unfortunately, when things go sideways, when they're audited or when there's litigation or fines, they will come back to the broker and say, why did you not tell me? So these are things we just want to make sure you're aware of, so that way you can provide that information to your groups. And lastly are the B&P Tools and Resources. These are, when I talked about increasing efficiency and saving time, these are the tools and resources we want you to have access to and be aware of, so that way you're not spending a lot of excess time looking for answers when we have tools that can provide those very quickly. So with that, one of the things we want to start off today is, as we go through each of the carriers, we want to figure out which of the carriers we need to spend more time on and which ones we can spend less time on. What this is here, this is the first quarter Q 2020, so January, February, March. What is selling in your area? And again, as we know, the California is broken up into 19 rating regions, and each of these are listed here. So for example, we're in Contra Costa County, so when you're looking at this sheet, you're looking at the bottom center where it says Contra Costa County, Area 5. And when you look all the way to your left-hand side, you're going to see Platinum. There's two Platinum plans. There's Gold, there's Silver, Bronze, and there's HSA options. What this does, it provides you a great way to triage your renewals as they come up. So for example, if I have a 2-1 renewal, I know that they're on a Health Net plan of the Gold. I'm looking here, and it looks like the Anthem Blue Cross plan is the most competitive plan for the Anthem, for the Gold 250/500 deductible. So if I'm looking for a plan in that space, the carrier that's most competitive for the first quarter in Contra Costa County is Anthem Blue Cross. When you go all the way to the right, you're going to see a parentheses. See that where it says minus 1.97? That means the next most competitive plan design is 1.97% more expensive than this one. Now, we all know we typically don't move a group unless it's 8 to 10%. So we would probably consider that, and if it makes sense, great. If not, we would probably leave it at that point. But let's go down to Bronze. Now, if I have a Bronze plan, and we're looking at Aetna, and you see where it says minus 22%. That is unbelievable. We rarely see a 22% differential between Bronze plans. And so in this example, if I'm looking for a very cost-efficient catastrophic plan design, I would put my group on an Aetna plan. because it's 22%. The next most competitive plan design is 22% more expensive. So these are the carriers we're going to be spending our time on today, the ones that you see on this space. When you have the sheet, you can scroll down. These are the other 19 rating regions throughout the state of California. The nice thing about it, on the very back, if you have an employer that's in one of these areas, you'll know exactly which zone to go to find the most competitive plan design. The team that's here to help you, this is an extension of your back office. It is myself as the sales rep. We've got 2 associates that are there to generate the quote activity for you, Tracy Gaspar and Heather Lewis. Either Tracy or Heather are assigned to your office to generate the quote activity. So if you have RFPs or quotes, please let them know. They'll get those turned around within 24 to 48 hours, so that way you can focus on the other tasks that you're being asked to do. Heather's our large group specialist as well, so any large group opportunities, Heather will take care of that. Kate is also doing ease, so any of you that have ease doing the online enrollment, we are starting to see an uptick in the amount of online group enrollments. If you do have a purchase subscription with ease, we will basically enroll the group, set it up, and then monitor it for you throughout the year. So that way, if you have any adds or deletes, we will let you know. Kate is going to be the contact for that. We do have a checklist that is completed. Kate will load it for you. It is tested, and then it can be rolled out for the group. This also takes 24 to 48 hours to go ahead and get you set up on ease, and obviously you have access to that as well. Heather, Twee, and Berlin are the underwriting team. As soon as the group is sold, it comes in. They are underwritten on a first in, first out basis to make sure that the speed and accuracy is maintained. Jennifer is available if I'm not, if I'm out in the field. Jennifer is the sales director here. Randy Halsey we call him the Great Oz, because anytime you need a special exception from a carrier and you're told no, we call that the opening negotiating position. And then Randy can go ahead and get involved. He's got some very senior level relationships with the carriers and can oftentimes get a special exception when needed. So please let us know any groups that we have with you. We're happy to jump in and provide assistance whenever you need help. Billing, claim issues are the 2 primary things where Randy's involved with. We want to make sure you get paid. So Kimberly is the account analyst. If you have any questions on your commissions, let Kimberly know. We'll make sure we get that taken care of. And then for those of you that don't have a workers' comp outlet, Patrick Kim is here in our office, and he can take care of that for you as well. So that is your team here to support you at all times. So let's get into the carrier updates. As we saw, Aetna is very competitive now, specifically in the bronze areas where we see, and that's what you're seeing up top. The PPO plans available for out-of-state employees that do not reside in that MC network, which is typically what we're seeing. The big value adds are listed there. The one thing we always want to point out is the militant deadline with Aetna. You have to have the group in by the 1st. They do not give you the leeway of the 6th like many other carriers do. So if you do have a group going to Aetna, please manage expectations for the group. Make sure that those turnaround times are met, get a head start, and then make sure the group is submitted by the 1st. If it's not submitted by the 1st of the month, it will roll to the following month. Moving on to Anthem. Anthem has been our biggest winner in 2019, wrote the most business with us, and continues to be competitive in 2020. You'll notice the areas are listed there. One of the big plan changes for Anthem in 2020, which was an enhancement, which is nice to see, is that they had deductibles and coinsurance for physical therapy, occupational therapy, speech, lab and x-ray, and now those are co-payments. So when you're asked to do a comparison, what changed 2019 to 2020? The plans actually, there was an enhancement made, and that's where you can point that out when they're asking why is the pricing gone up. At least there's something to show for it there. Last year there was a big change. IngenioRx is the new pharmacy benefit manager for Anthem. They bought their own pharmacy benefit manager. Anytime there's a change in pharmacy, there is a notice given out to your employees, and there's confusion. They're not understanding, why am I getting a new ID card? Typically, there's been a change. In this case, it was IngenioRx. Now that Anthem owns their own pharmacy benefit manager, that will help them control costs. So that's how you'll respond to that question as to why am I getting a new ID card, is because Anthem bought the pharmacy benefit manager. and hopefully those pharmacy costs, they'll see some lower rates going forward. Live Health Online. I personally have Anthem. I have an HSA account. We had my child was sick, and we actually called the doctor, got him on the phone after we were able to select from 10 different doctors to choose from. And we diagnosed it over the phone in our home, and he sent the prescription, and off we go. It literally took 10 minutes, never left our house. Live Health Online is the future of medicine. You can see your doctor a number of different ways. You can go into the waiting room and spend a couple hours there in unfortunately, a sick environment, or you can stay at home and contact a doctor for something that's not life-threatening. In this case, he was having trouble swallowing and just had a minor issue that he was trying to figure out, and we were able to get it diagnosed, and it was very simple. So if you do have Anthem, please make sure you're promoting the Life Health Online. This is going to be the future of how medicine is being taken care of for non-emergency related items. The app that they're promoting with Anthem is Sydney, so be aware of that. They do have some special promotions up in the North Bay, in the Chico area. As you all know, you cannot have a narrow and a full PPO network within Anthem Blue Cross. However, the exceptions are in the Area 1, which is in the Chico area, and Area 9, you can have a full and a narrow PPO. So if you're looking at having a base plan as the narrow and buying up to the full, you can do that in those two rating regions. And last is the value add. And there's a number of things that unfortunately a lot of brokers simply don't have time to go through. And a lot of these are extremely valuable. When we talk about an employee assistance program, which is included in Anthem, oftentimes that's not even mentioned to the employees. The other thing is this Pro Clear liners. It is $6,000 to get braces. For $1,200, I can get Pro Clear liners. I do it all through the mail. I make the trays, the implants, send it back, and I get now a whole list of these invisible liners that I wear 20 hours a day. And what it does, it straightens the teeth for a fraction of the cost. And this is something, rather than spending the money on Invisalign, Pro Clear Aligners is simply partnered with Anthem. Please make sure you mention that. This is a hot topic that a lot of adults and children are using right now. When fertility is another way to get discounted, the diagnosis and solution for infertility. This has become a huge problem as families are waiting longer to have children. And so the infertility coverage within a lot of these plans is minimal. So this is another resource that's available and partnering with Anthem. California Choice. California Choice, we had a big year with them as well. As you can see, some of the changes are listed there. The one thing we wanted to point out is that the individual coverage is not a valid waiver with Cal Choice like it is with other carriers. So please be careful of that when you have a lot of folks that are, when you're trying to meet participation, the individual coverage is not a valid waiver. We just had a group that blew up, unfortunately, because of that. So we want to make sure that that does not happen to any of you. Also, the value add services. It is amazing how we did an enrollment meeting for 1/1, and we mentioned Cal Perks, and we had an employee at the meeting who bought all of their Christmas gifts through Cal Perks meeting. They bought movie tickets for every single one of their family members through Cal Perks, and they were done. And this was the, I've never seen so much excitement over the discounted movie tickets. But please make sure if you're selling California Choice, mention the Cal Perks, because there's a number of discounts available with them as well. Covered California. Covered California is a great product. What they have done is made a number of improvements going forward. The big one is the new broker portal. I know there's been, in the past, I know Covered California has been a little challenging, but what we're finding now, I mean, they're not perfect, no carrier is perfect, but they are making a significant progress in that direction. So if you do have groups that are looking for a full network PPO plan alongside a Kaiser, and you have minimal participation, Covered California is a great solution. Also, the rates within Kaiser for Covered California are cheaper because there's no pediatric dental. So that is saving you $14 per kid per month. In addition to that, there is no administrative fees. So there's no monthly fees like you have with Cal Choice, which is going to be $30 to $50 per month, depending on the group size. There's no $30 to $50 per month fee with Covered California. So keep that in mind as well. As we move on, HealthNet. You saw on our sheet the competitive carriers by area that that HealthNet unfortunately is not showing up there. They are not existent in the Bay Area. They are heavily involved down and competitive in Southern California. So that's where we're seeing a lot of HealthNet. So if you come across groups, if you're prospecting and they have HealthNet here in the North Bay, it's a good opportunity for you to transition that to possibly a different carrier because of what we saw on the most competitive plan designs. Unfortunately, they're just not showing up at this time as competitive in the Bay Area. And one of our newest partner arrangements is with Kaiser. We're so happy to have that partnership. As you all know, Kaiser is very dominant here in the Bay Area. 20% of all the business that we wrote in 2019 for the fourth quarter was through Kaiser Direct. They been an amazing partner for us. We're very excited to have the opportunity to be the only GA selected in 2019 to represent Kaiser, and it's been an amazing partnership going forward in such a short period of time. The big thing that we wanted to share with you, sometimes you see ALT listed in the plan designs. Keep in mind that means that does include Chiro and Acu. That's just their indicator for that. That would create a little confusion, so we want to make sure you understand that. And also DME, durable medical equipment. Some of the plan designs did not have oxygen hospital beds included. Now it is included in all plans. So that's a nice enhancement as well. Individual coverage, not a valid waiver, just like we talked about with CalChoice. So please be mindful of that. And they are going paperless for billing unless the group opts out. So please make sure that you're aware of that because that creates some confusion as well. United Healthcare, extremely competitive in Sacramento and San Francisco. So if you're in those areas, pay special attention to United Healthcare. Typically, we sell this alongside of Kaiser Direct. Their plan name, they also said we've got Choice Simplified, and a lot of the brokers joked and said there's nothing simple about this. It's very confusing. The nice thing is in 2020, they have simplified. Now we only have 4 plans. And when we look at this, Area 3 is the one you want to be looking at. That's the one in the Bay Area. So Choice Simplified 3 going forward is going to be the one you want to be using. And I think that'll really alleviate a lot of issues. You'll notice that they have the pharmacy, and in the past they've had 2 different pharmacy. Now they've combined it, so now it's all on one, which is easy going forward. And you'll notice there that we've got the reimbursements as well. The fitness membership is one of the biggest ones that people like. So keep that in mind. United Healthcare has been also a great partner for us as well. Anthem Blue Cross, I mentioned at the beginning of our webinar here. And what's interesting about this is that for groups 100 to 300 eligible employees, this is the partnership that we have, which is an extension of the Anthem Blue Cross team that are located in Fresno and in Roseville. If you have groups in this space, please give us an opportunity to quote on it. The nice thing about this is that, first of all of the bonuses, overrides, commissions, all of it is exactly the same whether you go through us or you go through Anthem Direct. But there are some key differences. When we get involved, we're actually involved in inputting everything directly into the Anthem system. So the turnaround time is much faster. That's why we're touting the faster implementation. 24-hour member loading goes right in there, and it is a true GA override, meaning that it does not come out of any of your commissions or the group. The group is not paying for that. It is basically a cost incurred by Anthem. So we do have if you have any questions on it, please let us know. And what we do, anytime you have a group coming through us, we actually want to make sure as a partner, we offer you 2 options to benefit the group. Number 1, they can select this Alliance Access Plan. It is a $6 value that we include at no cost. It gives ID theft, legal club, and global emergency services to your groups. Or they can go ahead, if it's an Anthem only group, we're going to pay $4 per employee per month for the life of the group. If it's a combination group with Kaiser, we pay $2.50 for both the Kaiser and the Anthem employees every month for the life of the group. So this is a way, as we mentioned, we're trying to figure out how to increase profitability for your agencies. This is a great way to do it because, as you know, with these larger groups, they're always asking you to pay for things, COBRA, wellness. This is the money that can be utilized for that, so it will not come out of your agency's pocket. Moving on to legislation. Legislation is something that oftentimes when you go to meetings, the owner of the group is going to ask you what's new. And so this is a great tool that you can actually explain to them what's going on in the world of healthcare, so that way they feel current. The biggest items are listed here. Number one is Senate Bill 78. And what that means is that the mandate, everyone must have health insurance in 2020. In 2019, everyone had to have health insurance, but there was no real penalty. In 2020, if you don't have health insurance, there is a penalty. For those of you out on the production side, in the past, a lot of the employers were simply not interested because they didn't really feel like it was going to be a big issue by not offering health insurance. It is a big issue in 2020 because that employee that is not covered is going to be paying either $695 or 2.5 times their the California state income, whichever is higher. And that can be significant. So what we're seeing is a lot of employers, specifically in this tight labor market, are adding a health insurance plan because now they know that their employees are going to be subject to these penalties, and they can write it off as a business expense and obviously attract and retain employees at the same time. The other thing is that there's a reporting requirement. So there's an individual mandated reporting requirement. A lot of you are familiar with that 1095 B and C. This is very similar. So there's a penalty of $50 per person if they do not report to the franchise tax board. So please make sure you're advising your employers that this is the new law, it is required, and that they must have this required reporting in place by 2021. The next one we wanted to share with you is the increased covered California income limits. So you're probably hearing a lot of ads on the radio saying that the increase in the individual market assistance has gone up from 400% of the poverty level now to 600% of the federal poverty level. So now we're seeing more and more people gaining access to subsidized healthcare through Covered California. And you'll notice on this chart that if somebody is making, typically it's 138% of the federal poverty level. 138% for single individuals, typically $17,000. If you're $17,000 or less, typically you're on Medi-Cal. So we're going to have those folks will typically go to Medi-Cal. Anybody above that threshold will get a subsidy based on their income, based on this chart here. So this is how this works. There's been some confusion about it, but we want to make sure you have access to this. So when this question comes up, you'll be able to answer it. So what does that mean? That means somebody who makes up to $74,000 can now get a subsidized plan. If you're a single person, for a family of 4, it's $154,000. You can get a subsidized plan. So those are significantly increased limits. Sexual harassment has been, that was a big topic last year. They did push out the mandate. So the mandate has been pushed back to 1/1 of 2021 from 2020. So what does that mean? That means that the law requires any employer with 5 or more employees to provide either 1 hour of training if you're not supervising, 2 hours of training if you're a supervisor. And this has to be completed every 2 years. So hopefully everybody on this call has gone through it if you're with an employer 5 or more. And this is something we want to make sure that you're educating your groups on, because this is a huge issue going on right now. And it's important to make sure that everyone is gone through the testing. If you need resources for it, we do have resources here in Walnut Creek that we refer folks to. It can be done online, or you can have somebody do it in person. But again, it's a good thing to make sure that everybody is aware of and that they have met this criteria. HRAs, this has been a hot topic. We've heard a lot of employers are hearing more and more about this and are wondering, should I do this? Should I do my group plan? Obviously, we are big fans of keeping the group plan in place, but we just want to make you aware of what's going on with these HRAs. And there's 2 of them you want to be aware of. So these two HRAs, which are, this is federal now, not state, these are effective 1/1/2020. And what they do is they provide health reimbursement accounts for employers to simply have more flexibility than just the group health plan. Number one, you're going to hear it's called the ICH RA, and that simply means individual coverage health reimbursement account. And there's also an accepted benefits HRA. If you have any questions on these, we have two vendors that we have partnered with, Sterling and Task, and they're the ones that can get these HRAs set up if in fact your group is saying we really want to do this versus a group plan. The group plan has a lot more advantages, and so when you're able to, if you do have a situation where this does come up, we just want to make sure you have the resources to address the questions. With the individual HRA, this is going to be reimbursement for individual coverage or Medicare premiums. So some employers are basically saying, I'm going to drop my group plan, I'm going to have you just go out and get an individual medical plan, and then I'll just reimburse you some of that premium. That's the option under this individual HRA. And it's interesting because there's similar tax favored status as the group plan. But there's some things that we want to make you aware of. It can be offered by the employers of any size, but the big thing is that it can't be offered with a group health plan to employees in the same class. So class employees, as we know, the only class that's available is a union, non-union carve-out. All the other classes are not available. So this is kind of interesting how it was written this way. But anyway, the rules are here. Keep this in mind if it comes up. Otherwise, you don't necessarily need to go into a lot of detail on this. The EBHRA, that's simply for dental and vision. The individual is for the group medical, or it's going to be for the medical plan, and the individual, when you don't have dental or vision, that you can obviously have this one done through the accepted benefits HRA, and that's what that one is. The details are here. I don't want to spend a lot of time going through this. The next one is the 120 large group renewal notice time frame. If you're in the large group arena, groups over 100, in the past, you were supposed to get your renewal in 60 days. Now it's 120 days. So this is double the time frame that needs to get these renewals out. It's putting a lot of pressure on the carriers to go ahead and hurry up and try to guess with their actuaries what that experience is going to be like 120 days ahead of time. But that is the new law. And the PCORI fees are listed here. This is simply the Patient-Centered Research Institute, and that information is there as well. The federal spending bill and the California State Retirement Plan. Just want to make sure everyone understands the California State mandated retirement plan. Most employers have a 401k, but now they're basically saying that there's going to be, if you're an employer with 5 or more employees, you have to offer what's called Cal Savers, which is a version of a employee retirement account. Now there's no fees for that, the employer, but they cannot contribute. And you'll see that it is a Roth IRA after tax, and the information is there. So this is important to know. If you have any questions on this, we have a partnership with Human Interest, and they'll be able to provide you with more details on this. And then the Healthy California for All commissions is listed here as well. The resources I mentioned, again, we want to talk about how to save time and increase efficiency. We showed you the competitive plan by county. We have one for a PPO, and we have one for the HMO. Oftentimes the groups are going to ask you, well, what was my rate increase year over year? When you go here, this will actually break down from 19 to 20 based on plan designs on the 19 rating regions, what the increase was for the most popular plans year over year. So you can see this at a glance, what the rate increases were by rating region by the most popular plan types. So this is helpful to have in your back pocket. The other thing we wanted to share with you is if you have a full network benefit, the way this works is these are all the full networks. These are the ones that were most commonly quoted in 2020. And so you can see immediately for each carrier, these are their full benefits. These are the plan deductibles, out-of-pocket max, office visits, and that is your primary care doctor, your specialist, the inpatient hospitalization, RX and is there an RX deductible? This is extremely helpful because now you can see if I'm going to be downgrading or upgrading. All of the carriers and all the full networks are all listed right here. And there's a summary. You should keep this with you at all times. This is a very good tool when you're in conversations on the phone or when you're quoting or when you're meeting with clients. Great resource for you. The next one we want to talk about is this portfolio and network glossary. As you know, the naming dimensions change constantly with these carriers. So what we've done is we've put together this very simple tool. It's all of the nomenclature. So when we look about the plans, the portfolios, and the networks. So let's look at Aetna, for example. If we want to look at the plan design, what does managed care POS mean? Well, that is the PPO plans utilizing the managed choice POS. And these are the plans that are included with it. Now let's talk about the networks. So if I'm doing an Aetna quote and I see the value network HMO and it seems to be cheaper, why is it cheaper? Well, if I come over here, anytime you see subset of the HMO, that means it's narrower. And I come all the way to the right, it'll tell you the number of doctors and the number of hospitals in that network. You'll notice that the full network is going to be listed on top. That has the 74,000 doctors, 330 hospitals. But if we're going to be saving some money and going to a narrower network, you're going to see how much of a narrower network it is and what exactly it means when you describe that narrower network. A lot of times the questions that you're going to get are, who is the RX home delivery service that Aetna uses? Oh, well, it's right here. They use their own mail order service. The behavioral health network that they use is the Aetna Mental Health, and the pediatric dental and vision. All those questions are all answered here. And the beauty is they are all listed for each of the carriers available. So you'll know that, for example, we have Express Scripts listed here. We know that they've recently updated, so we're in the process of getting this document updated, but all the other information is listed here. So please take advantage of this. This is a great resource as well. Billing. So if I'm starting off and all of a sudden I want to know I've got a billing invoice and it's the group hasn't paid their bill, they're about to be terminated, they need to overnight or they need to call somebody, what do they do? So this basically takes you through each of the carriers. It tells you exactly what to do with all the billing question. When is it due? If I'm going to write you a check and I'm tight on funds, when do you process that check? Well, if it's with Anthem, you're going to be processed in 2.5 days. So it just gives me an understanding of when I have to have the funds ready to go. If you need a reinstatement, if it's late, it's all listed here. The other thing is, if I need to call somebody on a billing question, who do I call? Each of the carriers listed all across the top. All the billing departments are listed right here. You can hop off on the phone. We're happy to do it with you to get the billing issues resolved. If I need to send a check overnight, where do I send it to? Please make sure you reference this. There's a lot of addresses that show up. Please don't send the money to the wrong address. It'll take a long time for them to find it. This is the information that you should be referencing anytime you have a billing question. It is all listed right here. Now let's talk about cancellation. We're going to cancel the policy. What do we do? This is really helpful because now all of a sudden all the questions regarding cancellation are all listed right here, and the rules for each of the carriers are listed across the top. If we're going to cancel, where do we send the employer letter to? Oh, you just send it to that email address there, and it's a written cancellation, and you are all set. So this is also a great tool at the employee level and at the employer level, how to go ahead and put that into place. When we install a group, this was really helpful because we had a broker lose a group 1-1 because they told the group that they were promised. The group said, we are sick and tired of having these employees not get their cards because it looks like junk mail. They tossed it out. It just creates a lot of chaos. I want all the ID cards sent to my office, said the HR manager, and then I will hand them out, which seemed like a legit request. So the broker said, no problem. I will make sure that the cards are sent to you and you will hand those out. So let's look at this. So this group was an Anthem group. And let's see where it says, oh, the administration kit is here. Where are the, oh, here we go, ID cards. Where are they delivered to? Oh, they're delivered to the employee. They can never be delivered to that employer's address. This was a disaster. So the broker did not realize that the ID cards have to be sent to the employee's mailbox. So unfortunately, in this situation, once the employees realized that everything was coming to the mailbox, the HR manager asked the broker what had happened, and the broker realized that this was not possible. The group lost confidence with the broker, and they changed brokers over this simple item here. Do not let this happen to you. When you are asked, when can we expect the ID cards? This will share with you exactly when you can expect them. Anthem, 5 to 7 days after the approval. So this is a good reference to make sure that if you have questions, please use this to manage expectations for the group. In the fourth quarter, please pad these timeframes a little bit, because as we all know, things take a little bit longer in the fourth quarter. Hospitals. This is another excellent reference. And so if I am in Contra Costa County and I know that I want to go to the Washington, or let's say another example here, Alta Bates, Berkeley campus, and I want to save some money, I want you to quote me the Aetna Value Network, which is right here, AVN, and I tell you, please quote me that, and please put me with my doctor's access to the Berkeley Alta Bates. So you enroll me, I'm all set, and I go to Alta Bates, and all of a sudden, you see how this is blank here? This means that the Alta Bates Center in Berkeley is not in network with the Aetna Value Network. This unfortunately has cost another broker a group, because they did not realize that they quoted and overpromised. And this tool right here will go ahead and make sure that does not happen. So anytime you see a space, that means that that facility, in this case hospital, is either in network or not in network with the different carriers listed across the top, and the different, when you look at the different networks that are listed down here. So as we go from a full network to a narrow network, you can realize, why is it less expensive? It's less expensive because there's less of the hospitals in the network that are agreeing to a negotiated discounted rate. So this is really helpful for all the counties. These are in order of county. And you can look at this and reference quickly whether it's going to make sense to put them into a narrower network if, in fact, they tell you specifically that their kid needs to go to UCSF. Okay, we want to make sure that we're not going to run into a problem. So if you have any questions on this, let us know, but this is another good resource tool for you. Top selling plans, when we look at strategies, another good resource here. So what this tells you, the top selling plans by carrier, when we're looking at the different, this is obviously regionally, these are maybe a little bit different, but collectively throughout the state, these are the top selling plans for each of the carriers listed here. Another good resource for you. Ease, as I mentioned, Kate is our Ease professional. We are starting to see an increase in the number of online enrollments. I think we're slowly heading in that direction. You're seeing a lot of competition rolling in. These are high-tech, low-touch type solutions. We always want to remind you, be careful, because a lot of the employers still like that high touch. So you never want to be totally dependent on this. But as far as efficiencies go, this is extremely efficient. We have the ability now with our team to set this up for you, test it out, and then do the enrollment online. The information is automatically sent from the quote engine into Ease, and then we can transport it electronically to the carriers. One of the things about Anthem, we send the information, the enrollment information to Anthem at 9 o'clock in the morning. We get the individual member ID numbers as well as the group ID numbers by 5 o'clock that night. Unbelievable. So that is how fast the turnaround time is. So we want to make sure everyone is aware of that. Please let us help you if you have Ease. It takes a lot of time. What we were hearing is that there's an enormous amount of capacity that is allocated at the broker's office to managing the Ease process. And so since we do have that resource available for you here, let's free up some of your capacity. And again, it's at no cost to be able to increase efficiency and save you time. When we write a group with you, we want to make sure you take advantage of the partnership, and we call it broker picks. So if you have a group that's 1 to 5 or 1 to 4 employees, we can provide a POP plan, or we do the eCentral. 5 to 19, you have HR 360. Groups of 20 or more, you can pick from any of these options listed here. So I would encourage you, any group you write with us, please, we want to make sure that we take care of you. So in the example of ease, let's say we write a 30 life group, we're going to pay $1.40 per employee per month. That costs 30 times $1.40 times 12 months is $504. That is sent to your ease account to offset your subscription. So we have many brokers that their ease subscription is free because we've offset it with the amount of business we've written with them. So this is a great, again, resource to be able to increase profitability for your agency. At this point in time, with our 45 minutes, we got a few minutes left, but that is our presentation today. We wanted to thank each and every one of you for spending time with us today. Also, as I mentioned, you're going to have a copy of this entire presentation that's going to be sent to you. And if there's any questions, please put them in the inbox. And what I will do is make sure that we respond to each and every one of those. You'll have the copy of the presentation within 24 hours. And if we can have the opportunity to work with you in 2020, we would greatly appreciate that. Please give us a try, and we guarantee you will not be disappointed. Thanks so much. Best of luck to you in 2020. Have a great day. Bye-bye.